An amiable welcome to everyone. This is your allied Lecdem channel to enhance your understanding. Today's topic is about disinfection. Disinfection means a process that involves elimination of all pathogenic microorganisms except some spores, mainly on inanimate objects. And by disinfecting, all organisms may not be killed, but their number is reduced to the level that is, they are no longer infectious to human health. Here are some terminologies that are related to disinfection. First, antisepsis. It is a process that involves chemical destruction of vegetative pathogens on living tissue. Then, degerming. This involves mechanical removal of microbes from limited area. Then, sanitization, lowering microbes on eating and drinking utensils to safe levels. Asepsis, absence of significant contamination. And then sepsis, it involves bacterial contamination. Difference between antiseptics and disinfectants. Antiseptics are used on skin and mucous membrane to kill microorganisms, and it is not used for inanimate objects. But disinfectants are used to kill microorganisms on inanimate objects, and it is not used for skin or on mucous membranes. Chemicals that are used as disinfectors. Antiseptics. These are chemicals that kill microorganisms that are living in skin or mucous membranes. Bactericidal chemicals. So these chemical agents are capable of killing bacteria, and also virucidal, fungicidal or sporicidal are also agents that are capable of killing these organisms. Then bacteriostatic. These are chemical agents that inhibit the growth of bacteria but do not kill them. High-level disinfection. So here, high-level disinfection process destroys vegetative bacteria, mycobacteria, fungi and enveloped and non-enveloped viruses, but not kill bacterial spores. High-level disinfectant chemicals, which are also called chemical sterilants, must be capable of sterilization only when its contact time is extended. Intermediate level disinfection. So, intermediate level disinfectants kill vegetative bacteria and most viruses and also fungi, but not resistant to bacterial spores. Low level disinfection. Here, the low-level disinfectants kill most vegetative bacteria and some fungi as well as enveloped viruses like hepatitis B, hepatitis C, hantavirus and HIV. Low-level disinfectants do not kill mycobacteria or bacterial spores. Chemical methods. Chemical methods involve using disinfectants and antiseptics, surface active agents, which is also called surfactants, chemical food preservatives, aldehydes, and gas sterilization. The effectiveness of disinfectant depends on many factors, which involves each disinfectant as unique antimicrobial action and presence of organic matter and other compounds like soaps may neutralize some disinfectants, and also chemical nature of disinfectant. Many chemicals are used as disinfectant, and here phenol is the most commonly used disinfectant, and these are effective against gram-positive bacteria and enveloped viruses, and they are not effective against non-enveloped viruses and some spores. Hydrogen peroxide. So these peroxide includes hydrogen peroxide are often used as antiseptics to clean wounds, and the activity of peroxides is greatest against anaerobic bacteria. It is mainly useful for cleaning surgical sites after closure. There is no substitute for disinfectant, especially for some following procedures like hand washing, the use of personal protective equipment when handling blood, body substances and excretions, environmental cleaning, and taking care of yourself like immunization. Conclusion: disinfection refers to a physical or chemical agents that destroy pathogens or microorganisms that cause infections in humans. There are some level of disinfection that are high level disinfection. It destroys vegetative bacteria. Intermediate level disinfection. It kills most viruses and fungi. Low level disinfection. It do not kill mycobacteria but kill enveloped viruses. No disinfectant is substitute mainly for hand washing, environmental cleaning and taking care of yourself. Thank you.